Okay, dear students, glad to see all of you. And today we start to learn a course of lectures on your cycle medical care on your faculty. And today we should perform the first lecture, the entrance in propedeutics of internal disease. My name is Roman Gennadievich Mezin. I am a teacher, tutor, and member of Department of Internal Disease. Dear students, if you're ready, let's start. This is the main title of our screens, our lecture, and we can see that internal medicine, propedeutics, is an introductory course in the study of internal disease. This course of internal medicine was separated from general therapy in the 19th century. The development of new complicated methods of diagnosis and treatment. Okay, dear students, we start our first lecture of your faculty about post-medical care in therapy, internal medicine, propedeutics, or introduction to therapy. And we see the slide about the subject matter of internal medicine, propedeutics. And of course, internal medicine is an introductory course in the study of internal disease. The course of internal medicine propedeutics was separated from general therapy in the 19th century. The development of new complicated methods of diagnosis and treatment requiring specialized skills and training of the part of physician has led to the formation of separate branches of medicine, such as cardiology, such as pulmonology, such as gastroenterology, endocrinology, hematology, and nephrology. 6 basic parts. Internal medicine is a field of clinical medicine that studies etiology, pathogenesis, and clinical manifestations of diseases of internal organs and develops methods for their diagnosis, treatment, and prevention. The science of internal medicine, therapy, or internology, another name of internal medicine, is the most important branch of practical medicine. Knowledge of internal diseases has improved greatly. Many new diseases being described, the etiology and pathogenesis of the known diseases and clinical cause studied, and new methods of diagnosis and treatment have developed and improved. Despite the division of internal medicine into separate branches and therapy specialists, the basic medical training in the course in propedeutics of internal medicine, especially for the understanding of related issues of internal medicine, makes this course important and relevant. The amount of knowledge that is necessary today for a clinical practitioner much greater than in 10-15 years ago, and the requirement for adequate method training have thus increased accordingly. Discipline internal medicine propedeutics is very important because successful treatment of disease becomes only possible with a correct diagnosis. A good diagnostician is a good doctor. During the process of education in medical university, the students study the main methods of examination, symptoms of internal diseases, and the main principles of their management. This course is a course in diagnostic principles and special pathology, and internal medicine propedeutics is given to students after they have studied the fundamentals of medicine, such as anatomy, normal physiology, biochemistry, etc. During their further studies, the students broaden and improve their knowledge of all major internal diseases, their differential diagnosis, and their treatment. And students start managing patients independently. The doctrine of methods of recognizing diseases is called diagnostics. Diagnostics is a Greek name, is capable of recognition, is a section of medical science that sets out the methods and course of the process of examining the patients, observing and reasoning a doctor for recognizing a disease, and accessing a patient's condition in order to prescribe the necessary treatment preventive measures. Diagnosis is a concise conclusion by a doctor of the essence of the disease, the patient's condition, expressed in terms of modern medical science. So, diagnosis, MOBI, is a definition of the disease according to the accepted classification. The disease is identified on the basis of examination of the patient and the study of symptoms of the disease. The result of a diagnostic examination in the diagnosis of the disease. Then we said that diagnosis is a short medical opinion of the nature of disease and the patient's condition expressed in terms of modern medical science. A disease diagnosis is a definition of a disease in accordance with the accepted international classification of diseases. Diagnostics includes, first of all, study of methods of observation and examination of the patient, physical, laboratory, instrumental methods, health, medical or diagnostic technique. Second, study of the diagnostic value of the symptoms of the disease known as semiology. Again, Greek term semion, sign, or we call this term symptomatology. And third, study of special ways of pondering, aiming of identification of the disease, called diagnostic methods. And understanding of symptoms and syndromes. Syndrome is a combination of symptoms that have a common origin. The ability to distinguish among the symptoms and syndromes, the most important pathology, is necessary for a doctor to take a correct diagnosis and prescribe an effective treatment. As wrote the outstanding Russian therapist Grigory Zakharyan, a propedeutic clinic is actually practical semiotics, that is familiarization with the science of diseases in practical reality. The subject, internal medicine propedeutics, will help to find approach the clinical analysis, which will allow solving diagnostic problems of specific patients. Dear students, the patient's treatment is the main task of the doctor. Without timely and organized medical care, recovery is delayed or does not occur at all. And in some diseases, the patient dies without urgent medical attention. Most diseases cured by the force of the organism itself without its active participation. Recovery is impossible. As said the outstanding Russian therapist, Meklov, it is necessary to treat not the disease but the patient. The source of information about the disease is usually the patient himself. The patient is unable to speak, unconsciousness, confusion, or severe general weakness. The source of information about the disease is most often the weakness. The source of information about the disease is most often the patient's relatives. In this case, after the interview, their names should be included in the medical history, written down from the word's full name. In order to give the patient a correct diagnosis, it is necessary to collect biographical information about the patient, passport data, and then need to find the etiology. We call this cause of the disease. Collect the main complaints, the history of disease, called anamnesis morbid, from the moment of the onset of the disease, the present obtain information about the life history, called anamnesis written, include family, psychosocial, reproductive, allergic history, bad habits, and as well as patient injuries, operations, and other diseases not related to the main diagnosis. Next, dear students, it is necessary to examine the patient according to the system called status presence to highlight the clinical symptoms of the disease, and finally main diagnosis. After that, prescribe treatment as well as outline preventive measures to prevent recurrent episodes of the disease. The doctor performs examination of patient according to special scheme known as case history. The information obtained by the interviewer is organized in compensative statement about the patient's health. Traditionally, the history being obtained by using a disease-oriented approach, imposing the disease process that prompted the patients to seek medical advice. For example, a patient may present with the shortness of breath, and the interview will be conducted to ascertain the pathologic causes of the shortness of breath. On this slide, dear students, we can see the major sections of the history are as follows. First of all, biographic information, passport data, patient's name, second name, patient's sex, patient's age, and place of patient's living and patient's profession. chief complaints, then history of the present illness and main symptoms, past medical history, health maintenance, occupational and environmental history, family history, psychosocial and spiritual history, sexual, reproductive, and gynecologic history, and review of systems status presence. Biographic information includes the date and place of birth, sex, and ethnic background. The chief complaint is the patient's brief statement explaining why he or she sought medical attention. It is the answer to the question, what is the problem that brought you in this hospital? In the written history, it is frequently a quiet statement of the patient. For example, a regular nausea for 1 week. Patients sometimes use medical terms, and the interviewer must ask the patient to define such terms to ascertain what the patient means by that. The history of the present illness and main symptoms refers to the recent changes in health that lead the patient to seek medical attention at this time. Describes the information relevant to the chief complaint, and it should answer the questions what, when, how, where, which, who, and why. Chronology is the most practical framework for organizing the history. Enable the interviewer to comprehend the sequential development of the underlying pathologic process. The interviewer gather all the necessary information, starting with the first symptoms of the present illness and following its progression to the present day. It is important to verify that the patient was entirely well before the earliest symptom to establish the beginning of the illness. Patients often do not remember after when a symptom develops. If the patient is uncertain about the presence of a symptom at a certain time, the interviewer may be able to relate it to an important or memorable event. And in the patient-centered evaluation, the doctor must determine whether any main symptoms are also present and how they impact the patient. These symptoms, for example, include pain, constipation, weakness, and many others. Pain usually is leading symptom. Unrelieved pain is very common and is the origin, the most feared symptoms of illness. More than 80% of patients with cancer, more than 2/3 of patients dying of non-cancer diagnosis experience moderate to severe pain. There are approximately, and acute pain is caused by trauma or medical conditions, is usually brief and abated with the resolution of injury. Chronic pain persists beyond the period of healing or is present for longer than 3 months. Whatever the cause of pain, healthcare must ask repeatedly about the presence of pain and the adequacy of its control. Ask the patients severe questions. Are you having pain? Have you had pain in the past week? Tell me where your pain or pains are located. How has the pain affected your life? And are you satisfied with your pain control? The past medical history consists of the overall assessment of the patient's health before the present illness. It includes all of the following: general state of health, past illnesses, injuries, surgery, allergies, immunization, substance abuse, diet, sleep, and patient's current medications. To analyze general state of health, the doctor may ask, how has your health been in the past? If the patient does not elaborate about specific illnesses, says only excellent or fine. For example, the interviewer might ask, what does excellent mean to you? And direct questioning to appropriate and allows interviewer to focus on pertinent points that need elaboration. The record of past illness should include a statement of childhood and other progress. Recording childhood illnesses is obviously more important for pediatric and young adult interviews. All patients should nevertheless be asked about the measles, mumps, whooping cough, rheumatic fever, chicken pox, and scarlet fever. Older patients may respond, I really don't remember. It's important to remember that the diagnosis given to the interviewer by a patient should never be considered absolute. Even if the patient was evaluated by a competent physician in a reputable medical center, the patient may have a misunderstood the information given. Then the patient should be asked about any prior injuries or accidents. Ask, have you ever been involved in the serious accident, the type of injury, and the are important to record. All surgical procedures should be specified. The type of procedure, date, hospital, and surgeon's name should be obtained if possible. Then all allergies should be described. These include environmental, ingestible, drug-related. The interviewer should seek specificity and verification of the patient's allergic response. How do you know you're allergic? What kind of problem did you have? The symptoms of an allergy, for example, rashes, itching, anaphylaxis should be clearly indicated. And it is important to determine the immunization history of all patients. Substance abuse includes cigarette smoking and the use of alcohol and recreational drugs. The doctor should determine whether the patient smoke, for how long, and questioning the patients, do you use nicotine in any form, cigarettes, cigars, vape, and it has been estimated that the incidence of hazardous alcohol drinking in the United States ranges from 4 to 5% among women and 14 to 18 among men. In primary care setting, the prevalence rates range from 9 to 34% for hazard drinking. All-through studies have shown the beneficial effects of moderate oil consumption, 1 to 2 drinks daily. These effects are lost at higher doses, and heavy alcohol consumption is associated with many medical problems, hypertension, decreased cardiac function, arrhythmias, hemorrhagic stroke, ischemic stroke, liver disease, increased risk of breast cancer, as well as behavioral and psychiatric problems. When questioning a patient about diet, it is useful to ask to the patient to disorder what he or she ate the day before, including all 3 meals plus any snack, and how many fish meals does he or she have each week. What is the proportion meat in a diet in a comparison with fish or poultry? How much saturated in the diet? Does the patient add salt when he or she cooks, and do he or she add salt at the table? Has his or her diet changed recently? Are there any food intolerance? Does the patient eat food with high fiber content, such as whole grain breads and cereals, brown, fresh fruits and vegetables? The consumption of caffeine containing products such as coffee, tea, cola soda, and chocolate is important to determine. Caffeine ingestion may produce a variety of symptoms, including heart palpitations, fatigue, vertigo, headaches, irritability, and gastrointestinal symptoms. It is important to know a patient's sleep because this may provide information about the patient's physiological problems. Sleep-related complaints such insomnia and excessive daytime somnolence impair the lives of 20–50% of Americans. 80% of patients with depression complain of disturbed sleep, and 50% which with chronic pain experience sleep problems. And dear students can ask questions. When do you go to bed? Do you have trouble falling asleep? Do you stay asleep the whole night, or do you awaken in the middle of the night, unable to go back to sleep? Do you go to bed only when sleepy? Do you adhere to a regular waking time? And then we come to the part patient's current medications. doctor, the physician, should note all medications the patient is currently taking. Ask the patient to show you the medicine pack and tell you how the medicine are taken, and pay attention to whether the patient is taking them as directed in the instructed, and ask patients if they are taking any other medications. Next part is health maintenance. Physicians can play a key role in the identification and management of medical, social, and psychiatric problems. Counseling skills include building a support therapeutic relationship with the patients and family. The patient's family can be helpful in confirming the diagnosis and developing the treatment plan. Maintenance consists of three main areas: disease detection, disease prevention, and health promotion. The occupational and environmental history concerns exposure to potential disease producing substances or environments. These diseases can involve every organ systems because they often mimic other diseases. Occupational diseases may be incorrectly ascribed to some other cause. One of the important barriers to the accurate diagnosis of occupational and environmental disease is the long latency between exposure and appearance of the illness. Many occupational diseases have been well described over the years. The malignant neoplasms of the nasal cavities in woodworkers, pneumoconiosis in coal workers, silicosis in sand blasters and quarry workers, leukemia in those exposed to benzene, hepatic angiosarcoma in workers exposed to the vinyl chloride, chronic bronchitis in individuals exposed to industrial dusts. It has been shown that there is an association between sterility in men and women and exposure to certain pesticides, and between dementia and exposure to certain solvents. A careful occupational and environmental history is the most effective means properly diagnosing occupational and environmental diseases. The following questions regarding occupational and environmental exposure should be asked of all patients. What type of work do you do? How long have you been doing this work? What kind of work did you do before you had your present job? Attention must be paid to any temporal relationship between the onset of illness and toxic exposure in the workplace. Where the symptoms related to the implementation of any new chemical or process? Is there anyone else at work, or are there any neighbor with a similar illness? The family history provides information about the health of the entire family, living and death. And pay particular attention to possible genetic and environmental aspects of disease that might have implications for the patient. The age and health of all the immediate family members should be determined. If a family member is deceased, the age of the person and the cause of death should be recorded. It is important to inquire how a family member's illness affects the patient physiologically. Then, dear students, physiological, psychological history includes information of the education, life experience, and personal relationship of the patient. A statement regarding the patient's knowledge of symptoms and illness is important. Has the illness caused the patient to lose time from work? What of insight does the patient have regarding the symptom? Does he or she that about the future? And if so, how does it look? An excellent question that can elicit a vast amount of the information is: what is your typical day like? And then analyze a spiritual history, provides information about that gives meaning to the patient life. Spiritually helps patients cope with the serious illness, debilitation, and dying. This part of the medical history provides insight into your patient's spiritual needs and belief systems. The sexual history has traditionally been part of the psychosocial history on review of systems. However, because the sexual, reproductive, and gynecological history is so vital for the complete evaluation of the patient, these histories are now considered a separate part of the interview. The reproductive and gynecologic history obtains information about the woman age at menarche, regularity of the menstrual flow, and duration of periods. In addition, the numbers of pregnancies, numbers of deliveries, numbers of abort, spontaneous or induced, and complications of pregnancies are included in part of the history. In the reproductive history for a man, it is important to inquire about sexual interest, function, satisfaction, and any sexual problems. Has the man been unable to prostate? If so, is he aware of the reason? And conclusion of this analysis, all these facts. Thus, apparently collected anamnesis allows the doctor not only to mark correct diagnosis, but also to carry out the necessary amount of diagnostic procedures to confirm it, together with the appointment of an adequate and sufficient treatment for the patient's recovery. Dear students, thank you for your attention. Our lecture is finished, and please stay your name in chat about presence on a lecture.